Hey, Dr. Shakib here from Irvine's Spine and Wellness Center, your Irvine Chiropractic, Posture and Wellness Clinic. I'm here with Desiree talking about shoulder range of motion, workouts, physiological zone, some of the things you need to know about before you injure yourself. So stay tuned. All right, let's talk about some very specific information you need to know about. I'm going to demonstrate on Desiree here. Desiree, go ahead and lift your this arm up and bend your elbow and just in that position. So this is called a shoulder abduction. And what we're going to be doing is I'm going to externally rotate. Well, let's put it this way. Can you externally rotate? Can you just move your elbow back? So that's an external rotation of the shoulder joint, but keep it right there as far as you can go. So from here to there, which is a little extra movement, is called physiological zone. That's the zone where your joint's able to go to, but not by yourself. So with the help of something else or someone else, you're able to go through that range of motion. Injuries happen within that physiological zone. So when you're working out your shoulder joint, let's say you're rehabbing it, and hopefully you're not at a gym doing this, you're being supervised with the rehab process. When you're within that physiological zone, you have to be very careful. So you stay at the level where you're actively able to move it, and then with some assistance and supervision, you work your way through that physiological zone. If you load your shoulder up, let's say you're not injured, but you're working out at a gym, and you really want to pump up those muscles, and you're not really paying close attention to what you're doing, you don't want to lift something heavy, put it through that motion to the point where you're not able to hold it safely, and within that physiological zone is when you lose that ability, and that's when you end up tearing your muscles or your tendons. So it's very, very important. Every joint you have in your body has that physiological zone, so you should really see how far you can go and work comfortably to that level. And then if you want to up your game, you don't up your game with more weight. You stay with less weight and work within that physiological zone. And then up gradually on the weight and work within that physiological zone. So you condition yourself to do that. I see this all the time, especially when people go to the gym and see people working out and they're like, I want to do this. So their mind is all into that task of being able to perform, but they're not keeping into consideration their weaknesses that exist. We all are weak while we're working in that physiological zone and while we're expanding our range of motion. So be careful with that. I thought this video should help you be more cautious about it. If you have any questions, make sure you send me an email. All my information's in the description box. Watch the rest of my YouTube videos. Make sure you subscribe to the channel. And I also have a podcast, Life and Health Matters with Dr. Shakib. All this information is in the description box. And I hope that you got a value from this. Thanks for watching. Take care.